This video will cover occupational diseases related to ergonomics, including risk factors, cumulative trauma disorders, and analytic tools. Ergonomic risk factors can increase the likelihood of developing a musculoskeletal disorder, or MSD. Key factors include high task repetition, forceful exertions, and repetitive or sustained awkward postures. MSD risk factors vary by body region. For the neck, it is repetition, force, and static posture. For the shoulder, it is awkward posture and overhead work. The elbow is at risk from force, repetition, and posture. Other MSD risk factors include wrist and hand issues like carpal tunnel syndrome, tendinitis, and vibration exposure. Low back MSDs are associated with lifting, twisting, whole body vibration, and static posture. Specific MSDs and their risk factors include hand/wrist tendinitis, which is caused by combined factors like high repetition and forceful exertion. Hand-arm vibration syndrome is due to the intensity and duration of using vibrational tools. Low back MSDs are linked to heavy physical work, forceful movements, bending, twisting, whole body vibration, and static work posture. This table summarizes the types of musculoskeletal disorders and their associated risk factors, including neck, shoulder, elbow, carpal tunnel syndrome, hand or wrist tendinitis, hand-arm vibration syndrome, and low back MSDs. Examples of risk factor conditions include awkward postures, overhead work, twisting and carrying loads, wrist deviations, contact stress, poor shoulder or wrist posture, lifting bulky loads, hand-arm vibration, and whole body vibration. To prevent back injuries, workplace design evaluation should focus on minimizing excessive repetitiveness, reaching, lifting, and twisting. Factors in manual material handling involve the object itself, the people involved, the job tasks, and work practices. Repetitive motion and a fast work pace become hazardous when they involve the same joints and muscle groups repeatedly, too often, too quickly, or for a prolonged duration. Force is the effort required to lift or move objects and depends on factors like the object's weight, its placement relative to the body, and the posture used when carrying it. Injuries can occur when work continues despite developing fatigue. Vibration affects tendons, muscles, joints, and nerves. Workers can be exposed to whole body vibration or localized hand-arm vibration, often from power tools. Workers may use more force in awkward positions because vibrating tools are harder to control. Lack of recovery time leads to the inability of the muscle or tendon to recuperate from constant wear and tear, excessive or repeated use, and the formation of scar tissue that is not fully healed. Cumulative trauma disorders include carpal tunnel syndrome, de Quervain's tenosynovitis, lateral epicondylitis or tennis elbow, trigger finger, and thoracic outlet syndrome. Other disorders are shoulder impingement, medial epicondylitis or golfer's elbow, cubital tunnel syndrome, radial tunnel syndrome, and Guillen's canal syndrome. Carpal tunnel syndrome, or CTS, results from excessive pressure on the median nerve in the wrist. This nerve allows feeling and movement in parts of the hand. CTS can cause numbness, tingling, weakness, or muscle damage in the hand and fingers. De Quervain's tenosynovitis is tenosynovitis of the sheaths surrounding two tendons that control thumb movement. It is also known by several informal names. Symptoms include pain, tenderness, swelling over the thumb side of the wrist, and difficulty gripping. Lateral epicondylitis, or tennis elbow, causes soreness and tenderness on the outer part of the elbow. It's often caused by non-inflammatory degenerative changes in the tendon attaching the forearm muscle ECRB to the elbow. It is more common in middle-aged men. Trigger finger is a common disorder involving the catching, snapping, or locking of the flexor tendon, leading to dysfunction and pain. This happens due to a size disparity between the flexor tendon and the surrounding pulley system. The name comes from the finger popping back suddenly when unlocked, like releasing a trigger. Thoracic outlet syndrome involves compression at the superior thoracic outlet, putting excess pressure on a neurovascular bundle. It can result from positional causes, such as abnormal compression from the clavicle and shoulder girdle, or from physical trauma, repetitive strain injury, or anatomical defects. Shoulder impingement syndrome occurs when the rotator cuff muscle tendons become irritated and inflamed as they pass beneath the acromion. This condition results in pain, weakness, and loss of movement at the shoulder. Medial epicondylitis, known as golfer's, pitcher's, or climber's elbow, is an inflammatory condition of the medial epicondyle of the elbow. It involves several muscles used for flexing the fingers, thumb, and for flexing and pronating the wrist. Cubital tunnel syndrome is the compression of the ulnar nerve at the inner edge of the elbow. This often causes a tingling or, quote, pins and needles sensation in the little and ring fingers, but most cases are minor and temporary. Radial tunnel syndrome is caused by increased pressure on the radial nerve as it travels to the hand and wrist. It is speculated to be a type of repetitive strain injury from friction caused by muscle compression in the forearm. Guillen's canal syndrome is a nerve compression affecting the ulnar nerve in the wrist's Guillen's canal, similar to carpal tunnel but with a different nerve. Symptoms include tingling in the ring and little fingers, possibly progressing to burning pain and decreased sensation. It can be caused by pressure from bicycle handlebars or repetitive compression against a desk. Low back pain symptoms include pain, tingling or numbness extending to the leg, restricting activity and work capacity. Pain is often experienced when bending or stretching. It can be caused by a pinched spinal nerve due to a slipped disc, changes in the vertebrae, or muscle discomfort and fatigue. Causes of back pain include ergonomic issues like heavy or incorrect lifting, poor posture, prolonged sitting, and non-ergonomic setups. Other factors are stress or anxiety, lack of exercise, being overweight, injury, aging, and other socio-demographic factors. Applying a scientific, evidence-based approach to your ergonomics process is crucial. The goal is to identify and quantify ergonomic risk factors to make measurable workplace improvements. This ensures jobs and tasks are within workers' capabilities and limitations. Ergonomics should be an ongoing process of risk identification and reduction. This video discusses various ergonomic assessment tools, also known as analytic tools. These include the Rapid Entire Body Assessment, Rapid Upper Limb Assessment, Snook tables, hand-arm vibration, and the NIOSH lifting equation. Several tools are used for whole body and screening assessments. These include the Bureau of Workers' Compensation forms, Quick Exposure Check, and Rapid Entire Body Assessment, which help determine risk levels. The Rogers Muscle Fatigue Assessment and whole body vibration tools also provide valuable data. For the upper body, specific tools address concerns for the back, including the ACG-IHT-LV for lifting, Liberty Mutual Manual Material Handling tables, and the revised NIOSH lifting equation. These tools determine acceptable loads and required actions. Additional tools focus on the back and hand-arm region, such as the ACG-IHT-LV for hand activity level and the Moore-Garg Strain Index. The Rapid Upper Limb Assessment and WISHA hand-arm vibration analysis focus on neck, arm, and wrist positions, as well as vibration hazards. The Rapid Entire Body Assessment, or REBA, systematically evaluates whole body postural musculoskeletal disorder, or MSD, and ergonomic design risks. It uses a single-page form to assess body posture, forceful exertions, type of movement or action, repetition, and coupling. REBA assigns scores to body regions like wrists, forearms, elbows, shoulders, neck, trunk, back, legs, and knees. These scores are compiled using tables to generate a single value representing the overall level of musculoskeletal disorder risk. This slide shows the REBA Employee Assessment Worksheet, which provides a visual guide for the steps and scoring process involved in the assessment. The Rapid Upper Limb Assessment, or RUELA, is a diagnostic tool. It assesses biomechanical and postural load requirements on the neck, trunk, and upper extremities. The single-page form evaluates body posture, force, and repetition. In URLA, scores are entered for two body regions, Section A for the arm and wrist, and Section B for the neck and trunk. Data for each region is collected and scored, generating a single value representing the level of musculoskeletal disorder risk. Here is the RUELA Employee Assessment Worksheet. This tool details the steps for scoring arm, wrist, neck, and trunk positions, as well as muscle use and force/load. The Liberty Mutual Manual Material Handling tables, or SNOOK tables, outline design goals for various tasks. These goals are based on research from the Liberty Mutual Research Institute for Safety. Tasks evaluated include lifting, lowering, pushing, pulling, and carrying. The SNOOK tables provide weight and force values for specific manual handling tasks. These values are considered acceptable to a defined percentage of the population. Assessment is done by comparing task data against the appropriate table. Hand-arm vibration, or HAV, symptoms are caused by vibration damage to fingers, hands, and arms from vibrating tools. Vibration injuries are divided into three subgroups: neurological, vascular, and musculoskeletal disorders. This slide shows a hand-arm vibration exposure calculator. It helps determine daily and partial exposure points based on the vibration magnitude and duration for different tools or processes. The NIOSH lifting equation is used by health and safety professionals to assess material handling risks in the workplace, particularly for lifting and lowering tasks. This equation considers job task variables to determine safe lifting guidelines. The primary product of the NIOSH lifting equation is the recommended weight limit, or RWL. This defines the maximum acceptable weight that nearly all healthy employees can lift over an 8-hour shift without increasing the risk of lower back MSD. A lifting index, or LI, is also calculated to estimate physical stress and MSD risk. The WISHA lifting calculator was developed by the Washington State Department of Labor and Industries based on NIOSH research into the primary causes of back injuries. It can perform ergonomic risk assessments for manual lifting and lowering tasks, and is also used as a screening tool to identify lifting tasks that need further analysis using the NIOSH lifting equation. The Washington State Ergonomic and MSD Risk Assessment Checklist is designed to evaluate ergonomic risk factors, including awkward postures, highly repetitive motions, high hand force, repeated impacts, lifting, and hand-arm vibration. The Caution Zone Checklist is used as a screening tool. If no positive findings are identified with the checklist, the job is considered safe. Otherwise, a moderate risk is indicated, and the job should be evaluated using the Hazard Zone Checklist. Positive findings with the Hazard Zone Checklist require immediate action to reduce the risk.